Hello, I'm Kevin Kerr, an attorney in Portland, Oregon. I'm here with my law partner, Sarah Carroll, and today we're going to talk about getting Social Security disability for long COVID. Sarah, can you get Social Security disability for long COVID?
I think so. I've only had a couple of cases so far, but it certainly seems that the agency is taking COVID seriously. It seems that the most important thing that people need to do is get treatment and get treatment early and consistently, because this condition is ever evolving and people are learning new things about it. But yeah, it definitely seems like it's something that we can't argue, and we'll continue to have to argue for some time.
Now, it's obviously a very new condition. Has Social Security made any rules about it?
They have. They issued an emergency message where they went through, said essentially you can have a diagnosis of COVID, you can have a diagnosis of long haul COVID, you can argue that COVID caused a condition that you already had to worsen. You can argue that it caused or created a new condition. So they lay those out and specifically address it as an impairment that Social Security will recognize. It has its own code. So Social Security is certainly acknowledging this condition exists.
Now, Social Security disability is for permanent conditions, which has been defined as conditions that are expected to last 12 months or more. So in these type of long COVID cases, what is the time period you're looking at, and how do you meet the durational requirement for COVID?
Right. So, generally speaking, we're always having to prove that a condition has lasted or is expected to last at least 12 months. For long COVID, you're going to have to meet that durational requirement, but there's a couple of caveats laid out in the regulations. So they specifically address, if you get COVID-19, you have an acute case of COVID-19, and you're not expected to live, it's a terminal diagnosis, you don't necessarily have to meet that 12-month durational requirement. And result in death, you would not have to show that. They also talk about how you can project severity. So what we mean by that is when you apply, you haven't quite met the 12-month period yet, but you've had to do things like be on a ventilator, those types of things. Those situations are considered to be severe enough to establish it's likely the condition would last at least 12 months.
Now, we're just starting to see these cases get to the point where they go in front of an administrative law judge. Have you had any experiences with these cases so far?
Yeah, just very, very recently, I tested the waters with my first two cases. I was pretty nervous about them because I just wasn't really sure, if the judges were going to take these cases seriously. Judges are people, and you just really never know the way that they're going to look at things. So, in both my cases, were pretty different. I mean, in one situation, the person had the benefit of having gone to a long COVID doctor. So this person had seen a specialist, had been referred out to a lot of other specialists to rule out whether there was another underlying condition causing their symptoms. But they had a pretty firm diagnosis of long COVID. And there was really nothing else to explain the seizures they were having or the rapid heart rate they were having other than the long COVID. So I felt good about that diagnosis. That case was interesting though, because all the things that happened are kind of around the time period before we all knew what COVID was. So this person started having all kinds of symptoms beforehand, and so they suspect essentially that she had COVID before we were all taking tests and knew what it was. So the regulations do lay out that a person should be, getting the viral test, getting chest X-rays, being evaluated at the time that they have have COVID itself to establish that that's what it really is. But in this person's case, it didn't seem like the judge cared that much because she had so much treatment afterwards at the long COVID clinic. And they're like, yeah, all the symptoms you're experiencing are similar to what other people with long COVID had. And so that seemed to be sufficient. Now, is that exactly what the regulations say? Probably not, but it just kind of depends on the judge that you have. Now, my other situation was this individual who unfortunately had a month-long hospital stay, was so sick that they lost everything. They lost their home, they were evicted, they had to move across the country, and they've been dealing with terrible symptoms, but they haven't been able to reestablish health care yet. And so that was like the opposite case, but they still had very severe symptoms. And so at the end of the day, what I would say is what you want to do is apply, and we will do what we can to advise you about what the next steps are, what you should try to go to a doctor and establish at this point. But we will argue the facts we have and try to help people get through, this difficult situation.
Well, that was very informative, Sarah. If you'd like more information about how to get Social Security disability, you can visit our law firm's website, Kerr, Robichaux & Carroll at getssd.com.